Good morning. Thank you so much, Professor Jeff, for inviting us to share our experience at the King Hussain Cancer Foundation and Center, our model of change in turning fear of cancer into hope for life. "20 years ago in Jordan, the privileged few had access to quality cancer care, which was only available abroad. The remaining majority had to face the disease alone and suffer silently in a world of secrecy, fear, and shame. The burden of cancer would no doubt have a huge impact on all countries, and the burden is further amplified by health system limitations and social barriers such as stigma, taboo, misunderstanding of fatalism, and so on, which making equal access to quality cancer care really seems impossible. The situation of cancer in our country mirrored that one in many countries around the world, until one man had the vision to change the course of cancer care in our country once and forever. Because of His Majesty, the late King Hussain, vision to introduce quality cancer care to our region, our much-awaited life-saving institution was established with the vision to create positive change for cancer care in Jordan and our region. Our mission is to increase accessibility, availability, and affordability of quality cancer for Jordanian and for people living in our region, and changing the people's behaviors and encouraging them to adopt a healthy lifestyle and take an action and self-responsibility toward their health by adopting a healthy lifestyle for prevention and early detection of the disease. And of course, all of these efforts are supported by creating an enabling environment at the policy level through our advocacy efforts. To achieve our mission, we adopted a diagonal approach. We are using a mix of both social behavior change communication interventions at the grassroots level and at the same time having some impact at the advocacy level to create an enabling environment at the policy level through advocating with policymakers and decision makers, all of which are aims to encourage people to support our mission through donation or volunteering with us, or take a responsibility for their own health by adopting prevention and early detection, examination, and measures, and or create an enabling environment at the policy level or through their work, even if they are private sector actors, social influencers, or any other, all of which are contributing in a way or another to our life-saving mission. We are considering ourselves as a business with a heart. What does this mean? Our approach was based on Aristotle Model of Persuasion, where we worked hard in increasing and building credibility of our center as the only cancer care center and an outstanding cancer center in our region, and having support our case with evidence-based data, and then, of course, creating the emotional hook with our audience and our people in our country. In order to create and convening our credibility to the general public, we worked hard on different levels. First of all, our governance model. Our governance models as a standalone institution freed us of governmental bureaucracy, commercial conflict of interest, industrial hidden agendas. And of course, we worked hard in building partnerships with strong and well-known organizations, international organizations such as MD Anderson, St. Jude, and other international cancer institutions around the world. We worked hard in creating and introducing quality measures at all levels and building the capacities of our human resources and reversing the brain drain in order to build the trust among the public. In addition, we worked on having different and several accreditation and making sure that systems are implemented in order to provide very high quality cancer care for the people in our country. Of course, people need evidence to understand and realize the burden of the disease. So we conveyed a lot of messages and information about the burden of the disease in our countries to make people realize the size of the problem and face it and try to do something for it. And of course, sharing success stories for our survivors was another key element in creating an evidence that our efforts are working and cancer no more means death for people in our country. And of course, we do a lot of targeted research to understand the insights and the root causes that prevents people from seeking early detection and prevention practices for cancer at all levels. So we do a lot of research, case studies, and other research to understand the inside and understand their perceptions, attitudes, and behaviors, and the barriers toward adopting a healthy lifestyle. And also, we share a lot of data about improved early detection rates as an evidence that our work is making a difference, and that if we are providing them with access to quality care, then they will survive cancer. Equipped with unmatched credibility and supported by the evidence that I shared with you, we naturally moved into establishing a direct communication with our audience and having the emotional hook with them to influence their behaviors and practices. The first step to do so was through rebranding. For a long time, our institution was so-called the Hope Center. There was no mentioning for the word cancer at all. People in Jordan used to call cancer that disease. And we all know that the first step to fight your enemy is to recognize that it's a presence and to acknowledge it. So we changed the name of our institution from Hope Center into King Hussain Cancer Center. And that was the first step. Then we rephrased our messages, and the messages at different level. And to do so, we customized our messages according to our local context, making sure that people understand that cancer is present. Second, to understand that cancer is curable. And third, to understand that early detection and prevention may save lives. And we did a lot of work in rephrasing and working on customizing the message at different level in terms of the terminologies themselves, in terms of different layout and presentation and tools was used to display the message. And to strengthen the echo of our messages, we engage champions at all levels, with specific focus on opinion leaders such as religious leaders, celebrities, and even top management leaders. We know and we knew and we understood that our audience and our public are highly affected by opinion leaders. And in a way or another, they are linking everything in their life with religious beliefs and different social aspects. And that's why engaging religious leaders, celebrities, and opinion leaders was very, very important step in changing people's behaviors and perceptions toward cancer. In order to disseminate our messages, we used wide range of channels of communication at different levels. We started by extensive grass outreach programs for different purposes. To change the actual behaviors for people, for example, for the women to adopt early detection examination, we do an extensive home visits, one-to-one interaction with women to encourage them to discuss their fears and then refer them to do their mammography at different facilities which are available in their areas. At a different level, and to disseminate our messages at all levels, we use lectures, roadshows, open days, everywhere in the country to make sure that we are communicating with our people and we are sending the messages at different levels. And to create an enabling environment at the public level, we do extensive media and social media campaigns. We know and realize that social media and public media campaigns will not change behaviors. However, it will create the enabling environment and grab the attentions of different decision makers and opinion leaders toward the cause. So we utilize every channel of media and social media to make sure that our voice is heard by everybody and our messages are grabbing the attention of everybody. We engage the media professionals and making sure that they understand the cause, they understand the messages, and they are capable to convey these messages in a very proper way and very proper setting and context. Public awareness campaign, we do the October campaign, and we do other, the International Day for Tobacco and other campaigns. Again and again, we realize and we understand that turning everything pink will not change the behaviors, but it will grab the attention, and the work at the grassroots level will change the actual behaviors and practices of our audience. In conclusion, and through our very long experience, we think and we see that the pillar of change are building your credibility and standing your organization as a trustworthy source of services, of information, of changing behaviors. Then support your case by evidence-based data and information and scientific-based data and information. And of course, then move to create an emotional hook with your audience and target groups. This is our story. Thank you for giving me the opportunity to share it with you.